Bismillahirrahmanirrahim. Alhamdulillah wa salatu wa salamu ala rasulillah wa ala alihi wa sahbihi wa sallam ajma'in. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. Ameen Ya Rabbil Alameen. My topic today is a short talk about the acute pyelonephritis. What is acute pyelonephritis? Acute pyelonephritis is a common condition caused by ascending urinary tract infection. It is most common in women and usually caused by Escherichia coli. Less common infection, it is due to hematogenous infection, and here the causative organism is gram-positive cocci. Acute pyelonephritis may be bilateral or unilateral, and it may involve part of the kidney, and in this case it is called focal pyelonephritis, or involve the whole kidney. In non-contrast study, we will show unilateral or bilateral enlargement of the kidney with or without perinephric stranding. And sometimes we see it in ultrasound as area of hyperechogenicity with decreased perfusion, or sometimes normal kidney ultrasound. In MRI, it is non-specific and it is increased signal intensity in T2 imaging. And the differential diagnosis is include renal infarction, or sometimes lymphoma. As we see here, this is ultrasound of patient with renal ultrasound with pyelonephritis. As we see here in the longitudinal ultrasound of the kidney, we see hyperechoic area in the upper ball kidney due to pyelonephritis, and this is here the color flow ultrasound. We see perfusion defect in that area. With the clinical history and the presentation, it is in keeping with acute pyelonephritis. Here another patient with pyelonephritis, bacterial pyelonephritis. The kidney is enlarged, otherwise normal, and the CT scan of this patient show a global decrease of contrast material in the kidney with small attenuating foci due to abscess pockets, and this is the nephrectomy of this patient. And we see the small abscesses in the kidney corresponding to the CT scan. And this is the thickened fascia with perirenal strands. And this is courtesy from Radiographic 2008. Here another patient with pyelonephritis. We see here, this is the excretory phase of the kidney, and we see perfusion defect of the right kidney with some perirenal strands, and the right kidney is enlarged compared to the left kidney. And here we see lower cuts, we see also a perfusion defect in the kidney with enlargement and perirenal strands consistent with pyelonephritis. Here another patient with striated nephrogram involving both kidney in patient with acute pyelonephritis demonstrated in nephrographic phase. The same patient in the coronal cuts with striated nephrogram. Here another patient with asymmetric enlarged of the right kidney compared to the left kidney with multiple perfusing defects with striated nephrogram, and there is surrounding perirenal strands and stone in the gallbladder. Thank you very much for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.